not introduce the people online unless they ask for a public comment. So let's start with the Pledge of Allegiance. And Mr. Washington, would you lead us, please?
I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Okay, thank you. All right, I'll make another quick statement. I'll sure be happy when we get a new, we do not have a BOCC admin, nor do we have a secretary to the Board of Health. But we are working that, and soon it will happen. I hope it can't happen too soon. So in lieu of that, Dr. Brown, you'll take some notes, and Adrian, if you would help keep a few bullets, I'd appreciate it. So roll call, please.
Jay Prince.
Present.
Tom
Here.
Flower. Bill Kanda.
Here,
You need to wait outside, sir.
Cliff.
He's actually. Oh, I'm sorry. He is. Oh, is this Dr. Larson?
Yes.
Oh, no, this is Dr. Gilbert. Dr. Gilbert. Sorry.
Okay, you keep the roll going.
Yes. Okay, I'm sorry. Clint Smith. Present. Adrian Washington. Present.
And if it's okay,
And Cliff Brown.
I'll introduce him as, but that's that's the official board is all we're trying to people. Audience introductions. We also have in the room Dr. Gilbert here to help support today's discussions. Vernon Roth is the technician running the sound system for us now. And that should be it. Let's start off. Do we have any items to amend the agenda? And we'll start off with Jay. You got anything for us?
I have none. Thank you.
Tom?
Yes, I would move that we amend the agenda by adding an executive session personnel issue before public comment.
Okay. And I guess we want to.
In that motion, I would also include to invite Clifford Brown to sit in on that.
Okay. All right, it's been moved. I have a second. I'll second it. Let's vote on that. And any discussion?
I have none.
Okay, Jay? Good.
I vote aye.
Tom?
Aye.
Kanda, aye. And on that comment, I did have the agenda published, and we're modifying these agendas as we go along. For whatever reason, it was, there's always an executive session spot on the agenda on our BOCC meetings as well as these BOH meetings. And for whatever reason, when we edited this, it was left off. Also, I had a heck of a time with the editing on it initially. So and a version of this got out with the wrong time on, or the wrong, time was on it and the day, but we got that corrected. It'll be nice if we can get smoothed out here. All right, with that, and I don't think we have any minutes, do we, Dr. Brown? So we're good there. So without any further ado, let's poll the Board of Health members if they have any comments or items right now. Jay, you got anything to add?
I don't have anything, sir.
Tom?
Nor do I.
And I do not either. We've been busy. The meetings we've had have been 2 or 3 days spread, so there's not a lot to add. All right, so given that, let's move on then. So what's important today, and the reason we have this meeting is 3 days ago, we did have a meeting looking at the status of the COVID virus situation in the county. And at that time, we elected to monitor this more closely, and we spaced this meeting so that we could do that. We've got another Board of Health meeting coming up that was scheduled previously on the, I believe it's the 16th, the afternoon of the, or is it the 18th? Which day did we pick?
16.
It is the 16th, the afternoon of the 16th at 1:30, just so make that notice. The agenda will be published today, later, and put online. So stay tuned. And I'd like to ask both Clifford and the Board of Health members to, if there's any items, get them to me before I put it together, and then we'll pass it around before we publish it. Okay, Dr. Brown. you have the floor. Let's just take a look at where we stand with Custer County and the surrounding area.
Okay, Custer County today in Cedars is 28. We have a total for the year of 109. And we have 1,342 tests that have been done cumulative over the year. For the last 2 weeks, we're at 17.7%. And that's positive of the people tested. So
So
that's
28 in Cedars. So those would be considered active positive
yes,
cases.
those are positive
And
cases.
that's what you're using. The pools is only 1,342, and that's the number we're using to get our percentages.
No, the number that you have for your percentages are always taken off the number of total tests,
Right?
but it's tests in the same period of time. It's not.
Okay,
From
this
1,300.
this one was total tests. So
Yes.
can you give us the tests in this time, the number? Do you have it all, or did if
We
you don't have it, I'll get it
Yeah,
later.
we checked over the last month and there were 41 tests done over the past month. So, and that's the thing that I want to show some comparison to.
Wait a minute.
Okay, go ahead.
I'm trying to get to where we got 17%.
Yes,
What number did you divide what by to get?
that is the
17%?
state's number. Okay, that's where we're rated by the state.
That's our positivity rate.
That's our.
Right, it is,
rate.
but I was curious what they used as, do you know? Okay,
It should
The only
be
way we can do that, and I spent 5 hours on the phone yesterday trying to get them to give me those numbers. And hopefully sometime today, I will actually get them.
okay. So publicly, just so the public understands, the way it's performed, it's the total database of tests that have been administered
That period of time.
in that period of time, which is, that period of time is the last week or the last month.
We went for the last month, but in their calculations, it's over that last week
Okay,
section.
So in our case, that might be
Yeah, it certainly was
very small
1,300.
pool.
Yeah, it's.
Okay,
And that's why I gave you a number when we went back to I think it was the 25th of November. That was the number from then
okay,
up through our first week in December.
okay. So you're gonna have a number for us today that's not the state number then?
Well, I can do that, but I don't think it has a lot of meaning.
Okay.
That's what
Let's get to the,
I think
all
we're
right,
gonna.
just trying to get the stats down. All right,
So, sure.
go ahead.
So you're reporting we have 28 active positive cases right now.
That's
listed
what
in
Cedars, that's what's
Okay.
in Cedars.
And 109 was what?
That's the
Represented?
total positives for the year,
Okay, all right.
okay, for Custer County.
Since it began then.
Since it began, yeah, back in March.
Does that include the 28?
Yes.
Yes.
And what do you believe we have as active positives for our county?
I believe we have to add in 2. I think we have 30. Because I got a phone call or emails late last night indicating from another county, from their public health director, saying we have these 2 people.
Okay. The assumption is those would be listed in Cedars eventually,
Eventually,
if everybody's
yes.
doing their job.
Yeah, and that hasn't always occurred, but it usually occurs.
That brings up a good point, Tom, just real quick, because people are been asking me why your numbers sometimes are different than Cedars. And sometimes we lag, or they lag getting data, and as we do in this case, or we get some data they don't have because we had a personal call from another agency.
Right, so things that have not put in and assigned to our county can be actually put in, but they were put in aberrantly. So it was not, they've been entered.
So
in
sometimes
another
there's
county's
mistakes
numbers. That's right.
that are entered by the state because they're in another county that
Yes,
was
sir.
attributed to us.
Yes.
And then that gets straightened out eventually.
Right.
All right.
So then what number gets compared to our total population? I thought our positivity rate was based on how many positives turned up per 100,000 of population.
Yeah, there's a formula that is used. Let's see, I'm trying to remember. You have to divide it by, there's a division number, and that's right on the website. You divide the number, then you multiply it times 100, and then you have, for instance, if we're given per 100,000, we might have 25,000. Obviously we don't have that many people in a county, but that's what they use for calculation.
Right, so I would assume you take that 100,000 divided, or our population divided by the 100,000 and multiply that times the number of positive cases.
Yes, sir.
Correct? Because
Yes, sir.
obviously we don't have 100,000. So, and is that what they are considering the positivity rate, or is
Yes,
it?
sir.
So it's not based on the number of tests. That really doesn't play into it.
It really does. This is kind of interning, but yes, they try to include and compare us to our number of tests, which obviously, as the state representatives have agreed with me multiple times, it skews us because we don't have that number of tests. We don't have enough tests to show kind of what it is per our particular county's population.
Yeah, I was more interested in the definition and how we look at that versus what impact it would have on our county.
I can
Yeah,
actually publish that for you if you'd like the equation.
Thank you.
That's good, because that's where I was headed, because of the last meeting we had, I had understood that the total pool of tests is considered over a period of time. And then that's divided into the positives that came out of that pool.
Right. Yes, sir.
Right. And where we've had a problem is then we had 1,000 tests, for example, we have 5,000 people in the county. Then we would take that 1,000 into the positives. That gives us a number, and then we multiply it by 5, and that gives us our percentage for the county, which could be skewed.
Yeah, that
because,
would be for the year. Yes.
well, okay. Anyway.
Yeah.
We probably ought to get a formula down and agree that that's what we're using for the county. It doesn't have to and account for what's skewed and what's not.
Yes.
Because if you're always testing people that are symptomatic and you get 2 negatives and 10 positives, that gives an impression that we're at a 90% positivity rate, and we're not.
Yes, sir. That's it.
Okay.
In fact, the numbers that I wanted to give you right now, I checked with Chaffee County, and they're running, 150, between 100 and 200 tests.
Okay.
Per day. Go ahead.
Just hold off for a second, because the way I divided this agenda, we needed the stats of what we are, where we stand, what the surrounding counties, what their counts are. And then we're going to have a discussion under new business where we can actually make decisions and do some discussion. Okay. So I don't want to mix the two, otherwise we're going to confuse everybody.
All right. Okay, so as I said, we are, in my estimation, my count right now, because there are a couple of them that were not counted, were not entered into the Cedars roster yet. And that's why I said it's 20 plus 2, not what Cedars is showing right now. Okay. We have, like I said, also a cumulative total of 109. And we have, excuse me, for the last 2-week period, they have us listed as 17.7% positives. Okay.
What is the hard number on that for the past 2 weeks? How many additional positives was added?
Thinking back to my chart, we have had, I can't give that to you right now because I can't visualize all the numbers that I saw in the computer. But we have a number of people dropping off all the time, and we've maintained now around the 30 number for every 7-day period. So if we take that in 2 weeks, that puts us up to around 60 for a 2-week period. if that's what, if I'm
So
understanding.
you're assuming we dropped off 30, we picked up 30, but it's,
That's right.
but it's true. Every time we've met, we
That's
see
right.
24 to 30. And
Yes.
there.
So it's fairly constant. Although in the last couple of weeks, there have been more than what we've been accustomed to.
Well, may I ask questions, sir?
Go ahead, Jane.
Thank you. Well, Dr. Brown, when we met 2 days ago, one of the reasons we asked to meet again today is because at that meeting on Wednesday, there was a significant increase in the number of positives in Custer County. And we were very concerned about that. And we said, well, let's see by the end of this week what that trend is looking like. So we waited today to do this again. What is your assessment of the positivity rate since Wednesday or going forward?
It is held just about constant, except for one family, which 5 members of the family showed up positive today, like last night between 4 o'clock and this morning. So we are holding about where we had been. So there is no significant drop, Jay, to answer your question, and there's no significant elevation.
Okay, thank you.
Okay.
So I'm just trying to get my mind wrapped around this. I'm sorry. You say there's no significant elevation, 5 people, not that they were in a family particularly, but 5 more positives is not a significant elevation compared to what?
What we have experienced over this last week, we've been,
getting 5.
yeah, approximately 5 per day showing up, sometimes more, sometimes less. But in other words, there's not a big jump from Wednesday to today, which is, either way, drop or
Okay,
elevation.
so if we were at 3 or 4 on Wednesday, 3 or 4 on Thursday, 5 on Friday.
But we had 6, like on, when was it, Tuesday, I think it was.
Okay.
That's the last meeting.
Yeah, that was our last meeting.
So the point is, it's irrelevant whether it was a family or not. It wasn't an addition to 5. That's a total number. It added to the daily count of about 5 or so that we've been seeing.
Right, and we had a number drop off last night, so we have that family
I get it.
with that number, that set of numbers, and we have several more that were tested elsewhere
Got it.
that I've tried to include for you, but again, I don't have a hard number for you because it's not there yet.
I'd like to ask a question.
We're going to have to hold off until we get into the discussion on the status. Right now, he's just presenting data. And we haven't, we can give you a public comment here as soon as he's done reporting, if that's okay with you, please.
I muted her.
Okay, go ahead.
Comments at the very end.
Well, it's at the end, and then if where we're voting, that's true. Okay, go
Well,
ahead.
thanks. Appreciate it.
Are the tests counted individually or are they counted as total even if they take the test twice?
Hold on, I can't take questions. Let us keep the order going here so we don't get taken off the track. I keep that question in mind. You'll have an opportunity here under public comment, so just hold on. Go ahead.
Okay, we had a positive show up in the school, and so the school is essentially on virtual at this time. I just got off the phone with Mr. McFalls. So at this point, we are still classified under the state's category as orange. And I believe those are kind of the basic numbers that you guys need.
Okay,
Question.
go.
So did Mr. McFalls indicate how long they were going to be at virtual?
Well,
I believe it was for 2 weeks, but I cannot be quoted on that.
Well, I saw, let me clarify what I saw anyway. I thought we saw an email from him that said he was going to be that way through the holiday,
That is correct.
And that takes us through, yes, our,
through the end of December.
right.
Okay.
Yeah, so Christmas we're off anyway, so the 2 weeks of.
And through
school,
New Year's.
And then through the New
Right.
Year's. Yes.
Okay, keep it.
Okay, other than that, do you have any other
You were gonna,
numbers?
stats also should include what are the counts in Fremont County and then.
Okay, and that's,
Then we'll get into our discussion. Give us the data.
okay. In Fremont County, last week, they did 7,352 tests. That does not include the standard testing for staff or incarcerated individuals.
Those are only citizens of Fremont County. Testing for Custer County or other counties aren't included in those
True.
numbers, correct? Okay.
These are a drive-through situation. They're not in hospital.
Okay.
Okay. There are also other test sites. She broke it down for me, 2,121 at I believe it was the hospital test site, and there was another test site, I believe a quick clinic was 1,144. But just to give you kind of a feel so that you can compare numbers.
So those are how many total again? I didn't write it.
7,352 tests.
And these are people that are going, whether they feel the symptoms or not, they're just
Right.
testing
Showing
because
up.
they want to test.
Yes,
And
sir.
do you have a positivity rate for Fremont County?
No, I do not.
Okay, so that number really
well,
doesn't mean a whole lot to us.
Until
because
we see
it's twice as many, or
but what was it before? Are they riding around 10% or what?
They are higher than they were, just like we are. All the counties have kind of shifted up approximately the same because they have like 50,000 people in their county. We have 5,000 in ours, approximately. So when we say, where are we, the number of tests that were done are about 10 times, but they're more than 10 times what we have.
And
So
our
a lot more
population is more
testing.
focused on people that are
That's right.
sick feeling as
Yes,
opposed to people like Fremont, is that right?
Yes, sir.
Okay.
Absolutely. Although there are some of those too, because I asked her about that. And they very definitely have a segment of that testing population that does come in for the same thing. We got scared because we heard everything about Thanksgiving,
Okay.
that all the numbers are going up. The same thing in Chaffee County. And they do between 100 to 200 tests a day. They have multiple sites for testing, so it's very easy for people to do it. Do Monday through Friday. In Fremont County, they test Monday through Saturday. So they have lots of options, lots of
So
opportunities.
what's the Chaffee County number?
The Chaffee County, once again, is between 1 to 200 per day. So it's an approximation of about 150.
You gave us a number of 7,000 for Fremont. Is there a number like that for?
Right, I don't have,
Okay.
um,
How they were compared.
yeah, she had, I just was finally able to get a hold of her this morning, so I didn't get a large chance to talk with her.
Okay.
But they have between 5, I think this is what you really want to know, they have between 5 and 20 new positives per day.
Okay.
so according to the state CDPHE website, Chaffee County had 903 positives with a 5.3 positivity rate,
Over the past month, sir?
2 weeks.
2 weeks.
And then Fremont County was, I'm sorry, that's Fremont County, 9.9 positivity rate.
Right.
And Chaffee County's was 5.3. So
Yes.
we're 3 times higher positivity rate than
Yes.
Chaffee County.
Because of the way
Almost exactly.
the pool is set up. So.
Right. Once
All right,
again,
keep
if you
going.
test that many, you have such a large N, you have such a large denominator in that equation that.
Has more negatives.
That's right. So if you only test 5 people and one is positive and the other guy tested 500 and
Right,
one
get
is
it.
positive, so much difference.
Okay, keep going.
And that's where we have been effectively penalized and keep being penalized. There have been some good reports from people walking around the streets on saying people were wearing many more masks. So that's an encouraging sign. But remember, we are about a week behind. When we finally get our numbers, we're a week behind at least, and sometimes 2 weeks behind. So what we're seeing right now, again, is from November
A week ago.
and showing up here. So I am pleased to some extent that we didn't have, 3 or 4 times the amount of people coming in with positives from, and now we've seen most of the tests
Okay,
have come back in from Thanksgiving time.
good.
So,
Question, please.
Go ahead, Jay.
Thank you, sir. Dr. Brown, I failed to ask this question when you were giving the Custer County report. Are we still at 1 person hospitalized, or has that changed?
that has not changed.
Thank you.
That's still at 1 person, yes, in answer to your question.
Thank you.
CDPHE shows that we do not have any hospitalizations. So
Right,
clearly, the information is not accurate across all the platforms.
yes, sir.
That's why we have to concentrate on what the numbers are here in this county and doing our math so we're accurate. And I think you're trying to do that.
Yeah, and we're, like I said, by the end of today, I hope to have, no promises, but they have promised that they will be able to go back through and pull up all of the Custer County residents who have been tested wherever, throughout the state, so that we have a better knowledge, so we have a more accurate numerical basis for figuring out
Good.
what are positives.
So I would suggest, given that, and the formula you said that we need to figure out what our formula is. It would be good to post what we're doing.
Yes, we will.
So that people aren't looking at the state and saying, well, they're that way, and you guys don't know what you're doing because you got a number that's either higher or lower all the time. We just need to make sure we validate our numbers and are certifying that that's the way.
And I don't know how that is going to compare, because as we're seeing from Cedars, we don't have accurate numbers there.
Well, that's what I'm saying. We're not going to, we got to take that and extrapolate it, or whatever you want to call it, to be whatever we are using to make our decisions against. So
Yes, sir.
if they're skewed, we need to know why and how.
And that's why I asked the question, and that's
Okay.
why they are
Okay.
scrambling to try to,
Good.
I'm amazed that it has not been answered yet,
Okay.
but
Well, they're busy, just like you are.
yes. But I thought that number would be up, and
Okay,
they,
is there any other, are there any other
no, I did not,
stats that we need
I
to know
wasn't able
first
to
before we?
get any other counties on the horn.
So you said 830 tests in the last 2 weeks for Custer, or since
No.
we began?
No,
830 number.
the 1,342 is the number of tests since we began in March.
Okay.
That's total county tests.
Yes, sir.
Okay. All right, are there other COVID, that we got the COVID status? Are there other issues that we need to hear before we get into?
No, I'm really interested to
Okay,
try to go through these things. That's why I asked Dr. Gilbert
okay,
to join
all right,
us.
we'll do that. And then I know there's nothing from a sanitarian point of view today, right?
Jackie said she wasn't gonna be here. She had nothing to report.
Okay. All right, so let's get into that discussion then, Dr. Brown. We'll move into the new business, and we will allow public comments if we have a reason to debate or to vote on something.
In answer to the question that was already posed, those are counted again. And that was one of my questions to Fremont.
So restate it for the
Okay.
record.
I'm sorry. The question, I believe, was if a person gets tested twice, do those go into our cumulative yearly statistics for the number of tests run? And I believe it is yes, from the best of my knowledge.
Okay.
And we do have, once people have tested, even though they've been asked not to do it because of the overwhelming numbers for our laboratories, we still have a significant number of people going back in for a second test. Ideally, that is very good. After 10 days, I would love to know,
That's
are
very
they good to
good.
go back into the public again? But right now, we don't have that that clarity
Okay,
available to us.
so you're gonna present some more data for us today to
Okay.
discuss on how we're
Basically,
testing and where we're going and how.
yeah,
we're doing.
we do not have enough tests being done, but even when they're made available, when the testing is made available, we've not had a lot of people show up to take the free test. So it is very difficult. I mean, if we start to offer tests 5 days a week, for instance, or 4 days a week, which is what we've kind of talked about, doing an additional 2 days, Mondays and Wednesdays.
Doing them here in the
Yes,
in the
here in
county
the valley, so
somewhere.
people didn't have to go outside. But we don't have the CVS's, we don't have the Walmarts, we don't have all these other people in pharmacies who can do tests for us.
Right.
And we have not as yet gone into some of the other private companies, like they're using a company in Fremont called Mako, and I've seen the advertisements. And
They had a clinic also that they're using.
they have an urgent care clinic, plus they have the hospital. So they have numerous sites, again, that we don't have options on.
So what are you recommending then? I mean, is it an issue of making it the public aware that there are other places to get tests and that may not be aware of, like the fairgrounds in Pueblo or whatever you just mentioned, or that we would set up a special way up here and then we would have to make sure we publicly let the public know that by the press, whatever means that we need to do, I guess.
Yeah, I would like to see more days a week set up here. And we may need to bring in people from the state initially, and they have offered, to be able to do some of that testing for us.
With a makeshift setup, a portable setup that they would bring, or something that we would provide?
No, we would provide the space. It would be a drive-up type of thing, not a walk-in to a facility. But that's one of the things that I want to propose, because right now we just don't have enough testing of our population to even know how many people have already been positive and not been tested, or have refused to test, and that won't change anything.
Or even as importantly, in my mind, is to know the negatives. If it would be very helpful that in
Yes.
order to keep us from getting the press that says we have a very high positivity rate, if it's not, and we need to know both ways.
Yes, sir. We need to know one way or the other. So we need to know the negatives, we need to know the positives, so we can actually start to do a little bit of public health work, maybe slowing it down. As far
Where
as
where
the
it's
spread.
necessary, where it's
Yes.
popping up or where
Yes.
it's not.
Yeah, because if we don't have eyes on it, we have no way to make that kind of judgment.
Okay.
And we can't do the tracing if we don't have the contact. So anyway, that's in a nutshell, at least one thought, one approach to getting not only our numbers up, but to be able to effectively practice public health instead of just reacting after the fact.
Okay,
Well, Dr. Brown, I strongly urge you to continue that effort to get more testing done in Custer County. I think it's essential to know what is going on so we can deal with the problem. Asking people to go down to another site outside of Custer County is difficult, especially when people are afraid of going down to areas where COVID is so much more prevalent. I commend you and hope you are able to bring in more testing and more testing dates.
Jay, thank you for the comment. And I would add to that it's important because we sure don't want to, we want to keep the economic viability of the county going too. So it's important to get accurate data so we can keep the county open.
Yes, sir.
If the data indicates that, I'm not going there, Bill, unless
No,
unless the data indicates it.
It goes, but that's exactly right. And we need the data. That's what my point is.
I agree.
Could I?
All right, go ahead. Now you've got Dr. Gilbert.
Sure. In the context.
Speak up too, because the mic's up here. You can sit right
Oh, okay.
there in that chair if you want. And pull it back a bit so you're comfortable. And speak loudly.
Yes, in the context of this discussion, the important numbers for application to the rainbow, whatever you call it,
Can
and the
you
risk
time out here?
level.
Would you introduce him for the record so we know where he's coming from and
I
what?
could introduce myself.
Okay, this is Dr. Gilbert. He's a PhD virologist, very, very well respected and accomplished. I think we are
He's one of the,
very pleased to have him here, and we're very fortunate
and
to.
he's one of your resources in the
Yes.
public health agency. Is that-
Yes, sir.
Okay.
Anyway, what I was trying to get at is the important data for Custer County is the numbers in Custer County.
Right.
Pueblo, the Custer County residents tested in Pueblo, in Fremont, Chapey, whatever, are sort of irrelevant to Chase because they don't affect our numbers, which affect our decisions on what risk level we're at. However, we do get the positives, which is important because we know it's one test, one positive, and that person is coming back.
Right.
So what Cliff said, a testing program to greatly increase the number of tests done in Custer County, which will reduce our percent positivity rate, which is a measure of how badly we're testing,
Right.
will come down, and that'll affect whether or not our county is really in trouble or not. So to do it locally in county is very important because the data, as you all said, is not transmitting with any kind of robustness at all. Now, what was I going to say? Oh, the important number, which we should have for Custer County, is number of new cases per week per 100,000 people. So that's basically, you had one case a day, you have 7 cases per week. There's 5,000 people in the county, so you multiply 7 times 20, you've got 140 new cases per 100,000 per week.
Okay.
And that's that number that triggers your up and down in your color range. So
From our point of view, forget the state, but in our, that's the number we would use to make our decisions here in this county.
based upon the state
Right,
recommendation,
that's what I'm
I'm
saying.
not sure
Right.
to say forget the state because
No, I
that's
didn't.
exactly.
that's exactly where you're coming off
I
of.
understand, but I meant, I'm still focusing on what we're using here. That's what we would do. It should match the state. If they're,
Right,
if they're
that's the
current, my
important
point is
thing.
they're always lagging or not. We need
Yeah,
to be on
ignore
top
the
of it.
state data. Do our own data.
Yeah,
Get all the positives, all the negatives done in county.
Yeah.
And do more testing in county and base all your decisions on what's happening in the county.
good.
Exactly.
Well, I agree with your statement about make our decisions about what's happening in the county. I agree with that 100%. How we get that data, I take a different slant on. Is Cedars perfect? No, but it's a heck of a lot better than what we have locally for reporting for residents that are tested outside of the county. That's the only shot we have at those.
But the important individual outside the county that gets tested is the positive one.
Correct. Yeah,
And we get those.
yeah. Right. If somebody tests outside of the county, they come up negative, is that important to us?
It doesn't even get reported.
Yeah.
Well,
it is
it-
important.
But it's not important for the determinations you need to
Right,
make.
right,
It's curious
right.
data.
That's what I'm
The
saying.
important one is the test that tests positive,
Exactly.
which we get. So the next most important thing is to do as much testing as we can in county,
Right.
so we have a good number of positives in county
Right.
on a daily basis to know where we really stand.
So in your experience, do you have any recommendations on how we might go about convincing people this is not a scary thing to do? It's not like a flu shot some people are afraid to take sometimes, or
Well, it's not a shot.
I know it's not, and that's the point. Then do people understand it? Why do you think we don't get the attendance?
Well, level of service from the clinic, they're the only ones
Yeah.
testing, right?
Well,
Just 2 days a week.
yeah, so that would be
Was that,
something well, who knows? Maybe Heart of the Rockies might be better than our original clinic, but I doubt it, but you could look into that. See, part of the Rockies want to
Drive-through, you were
contribute.
Thinking about a drive-through.
You're right, that's what I was thinking, a drive-through either at the clinic or
Here,
at the courthouse or at the high school or the
or
school,
at the agency itself.
someplace. Because remember, all you're doing, driving through, gathering some information, sticking a swab up your nose, and then that swab goes off to a lab. That's it. So for the people, it's nothing. Do you want to, there are other events that I've seen happening, like there's a food giveaway. There had been every other
We got another
Saturday. or-
Still one coming up.
If you time the drive-through COVID test at the same time, you might get a twofer.
Yeah.
But why people are reticent to test, I don't understand. Because I would think everybody would want to know at some level what their health status is at the point they're tested.
Or they just are, just because of the clinic, there's only one place and they have
Right.
15-minute windows, then it takes forever. And then they just say, oh, I don't have time to try to squeeze in, and then they miss it.
Yeah, I mean, that's why if you had a couple $100 extra to hire a couple of people for a couple of hours.
Well,
Let's
see,
say,
now we
you know-
have an option, maybe from a CARES point of view,
Yeah, I was gonna say, if there's any money left in those things.
if for the next month or so, we might be able to consider something like that.
Yeah, in my mind, 1,300 tests, that's about a fifth of the county, a little bit more. You probably need about 75% to be comfortable that you're testing high enough that your rate, if it comes down below 5% positive, is good and we're doing well.
Yeah.
But
The other aspect that I was looking at and considering yesterday was perhaps getting in the rapid tests. And I believe, if I'm not mistaken, we can apply to the state and have them send us rapid tests. Are they quite as accurate? No, they're not quite as accurate, but they're pretty good. And if you show up positive, you could take another one within 24 hours and pretty well say yay or nay.
So
But that would give us this kind of,
Jay's got a question.
I'm sorry.
Go ahead. And then I'll click finish.
And I don't mean this as a negative comment, but if that's available, why have we not done that before? Why aren't we doing rapid tests now? I mean, the last test I had at the clinic took 11 days to get back. I could have infected 400 if I was positive. Unfortunately, I was not. But if I was positive, I could have infected half the people I dealt with during that period of time. I felt that to be very unacceptable. So a rapid test makes perfectly good sense to me.
If you believe the results, a lot of people don't. That's the big knock on the rapid tests. They're not as accurate.
well, the rapid tests are good for positives. They're less good for negatives. They have a high,
Well,
False negatives.
so are they,
right, it's a high specificity for positives and a low
meaning they have
sensitivity.
false positives? Is that what you're saying?
No, they have low false positives, high false negatives. That's another knock on them. It's good for, if you've got a real hot spot going on, it's good to go broadcast test everybody and find out who needs to be isolated. Not so much who in the general population doesn't have it.
That's right.
in Jay's experience with 11 days, that's the longest wait we've ever had. So we were getting them back in about 3 days. And so I said, okay, at least it's more accurate. We don't have as many people getting worried. And so we'll go at it from here. And then
Has it improved turnaround time?
the turnaround time has improved from 11 days.
But still a week.
But it's still, and it depends, once again, where they get tested, so which test is used. And we're getting some people back with a rapid test, within the day.
Some people never get their test results back, i.e. Clint Smith.
Yeah, that was the question I was going to ask, because it was a month ago now since I was tested in Pueblo by Maple. I never got any response, even though I inquired several times. So How often does that happen?
Yeah, who knows, you know?
And that's, I have no feedback because I don't know who was tested in the first place.
Right.
So I've got a question that,
Sounds like it.
as Jay indicated, it's not necessarily meant to be a negative. We've got to quit dancing around the bush here and face the music. On a scale of 1 to 10, I'll ask both you gentlemen, how much trouble are we in right now for Custer County?
Go ahead, Dr. Gilbert, and I'll give you my responses.
From what I have heard from various sources about new cases popping up and the level of cooperation with toning it down, I think we're at a state where if we want to tamp down our current spread, we should be at level red.
So on a scale of 1 to 10, how much trouble are we in?
8.
Okay.
Okay, and I'll waffle there because I don't know. I keep hearing reports, but I have nothing in hand. I don't have numbers that say there are sectors in our population who are experiencing symptoms, which make me very suspicious, but they don't come in and get tested. So,
Which is a danger to us.
which is a danger to us.
Raises that scale number up, right? I mean, it should.
And
Oh,
that's-
mine?
No,
Or, oh, yeah, anybody's,
If
yeah.
there are 6 people here and they're not getting tested, we're even in more trouble because we stand there.
If they're not
exposed and
taking care
everything.
of themselves.
Right.
That's right.
And
Well,
from what I've seen, a lot of the people are not self-isolating, they're not self-quarantining, they're not doing anything. They just stay out for a couple of days until they feel better and come back into the populace again. So,
You're talking about the people who tested positive or?
no, I'm talking about the people who didn't go in for any test at all.
unknown.
Which is the message we've been preaching, right?
What we're
Yes.
preaching, right?
Quarantine now means to wear a mask and do whatever you do.
Or stay out of the
So,
population.
And
whatever you do.
please act responsibly if you know that you have some symptoms that you're likely at least, man, don't go wandering around with everybody else. Take some responsibility and take care of yourself and them. And that's exactly, yes. So do I know in comparison with Dr. Gilbert's assessment, my suspicion is there, but I have no numbers to validate it.
So Jay has a question, then I have a point to make with it. Go ahead, Jay.
It's actually a comment, Mr. Chairman, and I personally, and this is really an anecdotal story I'm going to tell real quickly. I personally am in exactly the position you're in right now. I have symptoms, and that's why I'm not with you. I'm looking at what are symptoms for COVID. It's possible. I don't know. But I want to tell you, I feel I should go get tested. However, I don't feel well enough to drive down to Pueblo to get in line at the fairgrounds. I still feel ill enough to stay home and not go out at all, but that's not helping anybody whether I'm positive or not, because if I'm negative and I had a 24-hour bug, fine. But if I'm positive, I need to wall up in my home for a long enough period of time to make sure I don't infect other people. So I think what Tom has said and Dr. Gilbert said, we got to get more testing and we got to get it up here to make it convenient for people to get tested so that we know for sure what we're faced with. So
That's a good-
I don't want to
good point.
talk about my
Let me finish.
business, but it's just important. Okay, I'm
So-
sorry. I didn't mean to get on that.
No,
But
that's a
I fit
very
right
good
into
point.
your
We talked
discussion.
about it. So part of the discussion is going to have to be, you started off the discussion earlier with where we are. We're sort of whole mark in time. We do need more testing. And we're going to have to get some recommendations on that. And we're going to have to figure out what our next step is. Tom, go ahead.
So I got a couple questions. Did we give all of the county-owned test kits to Hardly Rockies
No,
/ the clinic?
no,
So we still have some tests.
yes, sir.
What would we have to do for the county to set up our own testing program?
Great question.
We will have to be able to hire some people or selectively
Volunteers, you're
get
saying. We need
volunteers who are
people.
qualified, yes. Yeah, we need personnel to be able to do the testing. We need a place to be able to do it. And I have several thoughts, and Dr. Gilbert has voiced, several of them. Go
The
ahead.
discussion on that point, are you able to, you have enough data to come back with a recommendation on how many people we gotta have and where it's gonna be? And a process that we could, because time's of the essence, we need to do it sooner or later, and it sounds like you all have discussed it with somebody. Have you?
Yeah, we've talked about it quite a bit.
So how do we go about implementing this idea? That's where I'm headed next.
Well, I would suggest that you allow me to sequester from the state, see if we can get some direct help, because they have offered at certain times to send down teams for a specific period of time. And maybe to get the program established, that would not be a bad idea.
And in parallel,
meantime-
get the volunteers
Yes.
lined up.
And in the meantime, get the volunteers lined up and see if we can make a go of it ourselves.
And how available are these people you're talking about at the state? Are they,
Well,
can they, if you call them today, are they gonna come next month?
no, I don't think that we're dealing with that kind of time period at all. I will know more, given the okay to do so. If I can sequester them, I should be able to find out some information for you on that by the end of the day.
Jay, did you have another question?
Yeah, I would just like to ask Dr. Brown to get with whomever, including Dr. Larson and anybody else he feels, come back to us ASAP with multiple recommendations. Let us vote on it and let's get this process on the move.
Exactly
And
right.
you alluded to that, Bill, and I'm just agreeing with you.
Okay.
So I will do that, sir.
How many test kits do you think the county owns?
Well, we right now, in my office, we have probably at least 150. Those are the 3-day, the PCR tests. They're not the rapid tests. The reason I brought up the rapid tests was that if you test positively one day, you can come back with a rapid test and test the next day. And if both of them are positive, you have a pretty good chance that you're actually positive. So this concern about being a false positive, I think, is a little bit overblown with a lot of people. It's, because we could then test using a PCR, we can use the other test to do a follow-up because it is much more accurate. And that's essentially what is recommended.
So how many did you?
We have we don't have any rapid tests at all. We have about 150 that I can count right now, 98 in one, and we have.
Okay, so the obvious question is, how do we get enough tests to get a valid bunch of tests? 150 isn't gonna help a lot.
Well, it certainly is hard to start with, because you have to be able to, you can't do more than a certain number in a day.
So are those other tests available that we can get into the pipeline? I guess where I'm headed is, I like the idea of getting a testing plan together with options. We're gonna have a meeting on the 16th. That's only 3 days away. Working days. And can you do something, get the data together, get a good recommendation?
Yes, sir.
By then?
Yeah, I can tell you how much they're gonna give to us, and if we can get personnel.
Yeah, the 150 that we have is the starting point. Whatever they give us, we can just continue in. The important thing is to get the county population to treat this as an event, if you will, and try to, yeah, like a pancake breakfast. You give a prize if you do it.
Yeah.
Because you don't want a select population just because that's what we're getting.
No.
It's people that feel bad come in. It's people that, when you're in town, come on by and have
I
a.
like your idea of coinciding it with some other event too.
Yeah,
but we have to do it, but
We have to, from Cliff, from the state, find out how many we can get, when we can get them, so that when you guys meet next, you know how much you're gonna have to approve, if anything,
Well, yeah.
dollar wise.
Well, there's lots of neat ideas. I mean, you could have it even associated with a business coming in and come on in and we'll give you a tip free.
Sure, at
Waiting
Main
for
Street,
your
who
bacon
wants,
and eggs.
yeah, who wants
Or
to
wait a day
support
start.
getting tested? And let them do their outside party or whatever.
We'll come back with some good ideas like that. And it's a matter of PR and getting people to have
Mhm.
confidence in what we're proposing and why. It's really why. It's for their, not only their safety from COVID, it's also for their economic well-being later on as well.
Yeah, we have to
have
be
the
able to justify through data where it is we are in terms of businesses being able to have 50% occupancy, 25, whatever.
Did you have another process?
Well, I got a couple of things. One thought is that all of a sudden, this desire to test as many people as we can, what's driving that? I hope it is not so that we can water down the numbers so that we don't look as bad as we really are.
Right.
And then I hope it's for just what you said, that we can collect meaningful, real-time data to make decisions on where we're at as a county and what we do for the
That's exactly what
color
it
scheme.
is for.
See, I hear a lot about the more we test, the less our numbers are gonna look as bad.
I look at it as
That's probably true.
accurate. It'll be. I
It
hope.
doesn't matter. Positivity is
Needs to be accurate.
compared against the number of positives to the number of tests given.
Right.
If we think we're only testing people that are super sick, sure, it's gonna inflate that number. I get that.
Right. If that assumption is wrong, then testing more people isn't going to help. our numbers.
Exactly. We still got sick people. Let's
We
deal
got a
with
lot
the
of
reality of it
exactly.
and not try to gloss it
Ignorance in the
over.
absence of data is bliss.
Okay, we've got a recommendation here. There's a couple people that want to
Well, I've
ask
got
a
another
question, but I don't want to
comment,
interrupt
yeah.
the comments.
We're not to public comment yet, are we? Okay. Where does Homeland Security fit into all this? Christy Coleman, have you talked with her? Is she a part of this? I haven't heard her name.
Let's let Adrian has
Oh,
been.
I'm asking Dr. Brown from Public Health.
Yes, yeah, I'm trying to remember within the last few days. You know, I don't talk with her every day, but we are not under a threat of invaders either. So, but we have this, and the meetings that she puts on, excuse me, the data that she gives out is very much considered in all of their decisions.
So they're involved in
Oh,
this.
yes, absolutely.
Haven't heard a word. This is the first, I brought it up, first time I've heard it since we have met as a Board of Health about Homeland Security, and are they involved? And if so, what does that look like? I haven't talked to Christy, so I don't have any idea.
Okay. We have, in fact, I'll defer to Adrian, but we have almost constant contact, if it's not every day, every other day, with Christy, with what's available to us, with planning for essentially a disaster where all of the services are overwhelmed. Parkview is essentially overwhelmed. They will take patients, but it's hard. You got to really give a good case. The same thing with Thomas More. Can you get them in? Yes, you can. Do they have a few more openings up in the hospitals in Salida? Yes, but it is still, hospitals are being pushed, but she is a part of the awareness that is ongoing.
If there are other aspects of that that are deeper than that, I mean, that's one aspect of the hospital's role, but in the con-op of that agency, it's broader than that, right? I mean,
Yes, sir.
They're considering the big picture.
Yeah, they try to help us with tests. They try to help us with materials, with personnel.
Okay.
Adrian?
We meet probably
Speak up.
5 times a day.
We being,
State emergency management and all the OEMs in the southern part of the state, in the southern region. We were on conference calls, getting specific training on the vaccination that is coming up yesterday. We monitor what's happening in public health, and we check our statistics against their statistics. And I would say that it's a very, we know what's going on in every county. So public health knows what's going on. We know what's going on. We look at their numbers. We look at our numbers. We make suggestions. We look at the dial. I would say 60% of my time in the last 2 weeks has been devoted to public health matters.
I haven't even mentioned vaccinations and starting. We are not part of the -70 vaccine, but we are part of the Moderna, the secondary that doesn't require that extensive cold. And so, I'm
If I
sorry,
may add to that, Cliff, we were notified this morning that there are 100 vaccinations or vaccine possibilities coming to Custer County. We could have
100 win.
we could have it by the end of the week or by the end of this weekend. And so
In 3 days.
we could have it by the end of the weekend.
Okay.
It depends on whether the FDA approves the test kits. There's a whole system in place for every county. They sent out a list this morning saying exactly what each county would receive. And we could have that by the end of.
Okay, so let's hold that thought because we got two things now. We've got the testing is, I want to wrap that up because there's a couple of hands that are up that probably can comment. Right now, from a testing point of view, we've agreed we will come back on Wednesday and have some options, and maybe there's a couple of questions that are relevant to listen to for right now on that. Then I do want to get into the vaccination and where we stand and how we're going to handle that. So when we get those 100, we do something with them immediately. So, all right. Okay, Jay, go ahead. And then I'll open.
Thank you, Bill. I don't mean to interrupt you. I'm just not sure if you see my hand waving around. I just want to ask you and Dr. Brown, is the 16th, our next Board of Health meeting, is that
Yes.
sufficient time for you to come to us with a plan for Custer County to do more testing than it's doing now?
That's the question I asked them, Jay. You may have missed it, and they said it was. But if you
Okay.
need, are you suggesting are you still good with that? Are you still looking at the 16th, guys?
16th is Tuesday.
Wednesday.
I'd say yes, unless there's a glitch that we tell you about.
Okay, well, we're going to have the meeting anyway, and if there is, we can move it out.
Sounds good. Thank you.
All right, Vernon, can TC Smythe, is it Smith or Smythe?
Bye.
Go ahead, TC. Unmute.
You're asking me for something?
Well, you have your hand up, so that's the only reason I have it. Did you mean to have your hand up?
I don't know that I have questions, but I didn't know my hand was up. I'm sorry.
There's a hand up on the screen, so you can sure ask your question if it's related to what we've just been talking about.
Are you sure you don't want somebody else to go first? Because I kind of botched it last time around.
All right, well, you can sit then for 1 minute then. Let's go with Nita.
Thank you.
Hi, thank you for giving me a chance to speak. A couple of things, and I think it's been said, but just on that clarity, that a high positivity rate means we're not testing enough. I mean, we're clear on that. And it's not a measure of the percentage that's being infected. And so we're not doing enough testing. And I wish, I think we're behind the 8 ball. I wish we had pushed for this earlier. And I think a couple of things. I really have concerns that we're not going red right now, because I think the signs are there, and I know that hurts economically, but it's short-term versus long-term that I really hope the Board of Health will look at. And then thirdly, as I know you're discussing, marketing is crucial in this. I mean, 2 things. One is getting more, getting a plan in place where you can get more testing that is the drive-through, that is really, really simple. That's crucial. And marketing is so important because, as you all have seen, as I have seen, we have so many naysayers here saying, oh, it's like a cold, they're making it political, which it is not political. So I would urge our county commissioners and our Board of Health to market this, to not just say, oh, we're recommending that you wear a mask, but to really push this of how serious this is and to market it, because I have not seen that. And that is, to me, a big concern. That if the community knows that the county commissioners, the Board of Health, and Dr. Brown are all saying, please get tested. Please do this. This is crucial. This is not hearsay. So please, I am urging you and begging you to do a strong marketing on this. Thank you so much.
Good points, and thank you for your comments. And as a matter of fact, I'm hoping that that's part of you when you're that. I wrote down PR test when we were talking about other marketing, basically the way she said it. So
Yeah,
thank you for the comments.
Between Cliff and I and Dr. Larson, or whatever, we can have you a marketing draft document pretty
Okay,
much.
good. All right, and TC, you're the only other one that has a hand up if you still have a question. Otherwise, we're going to move on to the vaccination discussion.
I have it together. Thank you. I don't think everybody in the room knows that Custer County has already had a free drive-through COVID testing thing at the clinic every Tuesday and Thursday from 1 to 4 p.m. since May.
Yep.
So that's still in effect, and you can still go get that, and you can still get your flu shot at the health agency on Mondays and Fridays, right? So that's common knowledge, or it should be.
Well, that's a good point, and that is true, and that's a good piece of things that we need to be marketing. That's for sure.
Now, I heard your discussion back and forth about how come we don't have certain data and we have others, and it comes from the state and it comes from us and blah, blah, blah. However, I have all the formulas you need to calculate all of the stuff that the doctor was unprepared to deliver today. I have it in a spreadsheet that will calculate it for you automatically every day. All you need is the bulk number of tests you've done that day. And I do this every day for my report, so I'm happy to share it with anybody that wants it.
Okay, thanks for the heads up.
Now, and if 28 families are currently isolated, they're going to need help avoiding breaking quarantine. It used to be back when I had COVID that the Office of Emergency Management offered delivery of essential items. And I wonder if Mr. Washington is there, maybe he could tell us if they are still doing that or if they would be prepared to do it again. That way it keeps folks out of the grocery store that don't need to be there, right? And then the health agency's Facebook page has 3 hospitalization cases, newer than, I think it was November 2nd, we had listed 1. Now we have 3 since November 2nd. I didn't hear anything about those.
That's erroneous. Let's fix that rumor. Dr. Brown, we've had 3 total.
Okay.
That I know of.
Well, it's still on their Facebook pages so
okay.
just, I'm sure they'll take care of that.
We'll fix the Facebook page.
We have had 3 for the year, including 1 just this last week.
Thank you. Okay. Now, since Parkview is full and they're transferring patients to Colorado Springs, doesn't that mean our 3rd COVID color dial criteria is now red or passed, and that all 3 of them are red?
Well, Dr. Brown or Washington.
That is what we've been dealing with. That's what we've been trying. And you said you can offer everything that comes back positive. Yes, you can. But the bottom line is you also need to be able to know how many tests were done. And that is what I was trying to allude to as far as developing a way to get a hold of those tests, the number of tests done, so we can have not only the number of positives, but the number of negatives. So you have some kind of feel for what's real.
Yeah.
Not just a skewed population. We tend to have a skewed population anyway, because just the people who are feeling badly in general are the ones who come in to get testing.
Right.
All of them.
Right, but I'm thinking the people who've gotten tested outside the county represent a very small proportion of total tests, and the number that you have done here will be good enough for that purpose of determining more or less where we're at. Should we be concerned? We can know that just from our own local numbers.
I don't know that that's the case because a good share of the number who are positive have been tested outside the county, which intimates to me that we probably also have a good share of negatives that have been tested outside the county. I don't know. I don't have those
Yeah.
numbers, TC.
Yeah.
I just
Right.
don't.
Okay, we need to keep
Thank
moving.
you.
Thank you, TC, for your comments.
By the way,
This is Jordan with the Tribune.
Hold on one. I didn't see your hand up. Go ahead.
I also.
Yeah, I don't have the video on.
Okay, just a second. Go ahead.
I also offer every patient.
Yeah.
Wait a minute. I'm sorry. I should have said, go ahead, Dr. Brown. We let him finish.
I also offer every patient that I phone, I'm sure I missed some, but I try to phone every single patient who tests positive. And one of the things that I do offer them is that I will bring them groceries or anything else that they need that they don't have in their house. So they can continue to isolate.
Right, and I think that's a good point to make in your presentation back. How do we help that? I mean, that's a good point. I know the BSO here, our people and the VA and the American Legion all have programs and are willing to volunteer to keep people at home by bringing them food.
Yes, sir.
Do we know how the guy in the hospital is doing? Is he all right?
We know that he's okay.
Let's not discuss it.
But we're not.
Oh, okay. Sorry. Bye-bye.
The HIPAA thing we're going to breach if we're not careful. All right, go ahead. Let's see. I do want to get into this vaccination thing. Jordan Hedberg had a question. I didn't have his hand raised because he's not on the video.
Yeah, thanks. Yeah, so
On
main
the
question is that
Jordan, please keep it toward the testing issue. Go ahead.
no, I agree. But what's the point of collecting more tests and talking about red versus orange when the Tribune did a story that Dr. Brown contributed to and Clint Smith that there's going to be no enforcement on any of it? So why are you guys talking about test positivity and all this other stuff when it's clear, and this was 2 weeks ago done in the Tribune, that there won't be enforcement and that there really is no legal recourse to even try enforcement? So I'm kind of confused why we're all talking about testing when red and orange is already decided that doesn't matter.
It does matter, and thank you for your question. And actually, that statement is true from the beginning. There's no enforcement in Custer County from the Sheriff's Department. There is. We're looking.
No, this was a statement from Dr. Brown. It's in the Tribune and the email and Clint Smith that enforcement is impossible.
Mute him now.
There is no enforcement in this county.
Period. Okay, thanks. Thanks for the comment. Okay, let's move on.
Okay, you wanted to know the vaccines. I just saw on our page today that there were 100 assigned to us, Custer County now, okay? So we have gone through the training, our nurses have gone through the training to give the injections, to handle the people and to have things organized. So that is a program that's already in place. Okay, we've already gone through everything we have to go through to qualify to be able to do those things. So that is set up. As there are more vaccines, and I suspect that there will be more vaccines come on the market, we hopefully will be getting enough to be able to continue to expand, because we have a lot of people who really want to have a vaccination, want to call this thing to a close and go back to normal again. So we will put out, but we have to follow right now to get the vaccines.
So are you prepared? I guess the real question is, Dr. Brown, you know it's coming. It could be here Monday. Are you ready to?
Yes, we are.
You know, do you want to describe what your thoughts are on the priority so that the county, or the people, the public is understanding what we're going to do?
The thoughts and the priority are dictated to us, federal government, state government, and so on. And those start off with our first responders. So everybody who is likely to be quite intimately exposed to people knowingly exposed to people or that are positive for COVID, those are the first people who are on the line for receiving the test. And as I published just the other day on our Facebook, thankfully, at least the employees from our medical clinic, our local medical clinic from Heart of the Rockies are all covered by Heart of the Rockies from Salida. So those are not being taken off of our limited supply of 100. So we go into our first responders. We're looking at our EMS because they are likely to be extremely upfront. So, and any other primary care providers, medical providers in this whole Custer County. And that was gone through and the numbers and the groups were decided on by a tabletop exercise that they went through. I believe it was on Wednesday. Adrian, was that? Yes, Wednesday. Okay. So we have a list that follows precisely, but we wanted to have actual numbers. And without the tabletop, we didn't have this. So that has already been gone through. The courses have been passed to allow our providers to do the injections, to do the vaccinations. And I believe, as far as I know, at this point, we are ready to go.
You're prepared.
Yes, sir.
Any questions? Jay, questions?
No, I'm good, thank you.
No, it's not a question. I just wanted to comment back to what Mr. Hedberg was getting at. I think even though I think we all agree that there's no legal enforcement in place, I support to try to be proactive and encourage the citizens of this county to do what's right. Not because there's a damn law that says it, but because it's the right thing to do.
Right.
We have really not had that conversation. It's all been arguing about, well, it's not a law, so what the hell are you going to do about it? I say what we're going to do about it is we should be asking people to do what is right for this county, for the health of this county. This whole idea of, and I've been told it, I'll bet 50 times, just let us make up our own mind. We can be in charge of our own stuff. Well, that's not our job. Our job is to try to be a leadership role to help do what is right for the health of the people of this county. So if we get down to the only reason we're going to do it because the law says we have to, then we're screwed as a society.
That's right. Absolutely. Good point. Thanks, Tom.
So the responsible behavior, sir, is exactly what we've been trying to promote, trying to give options to people and explanations to people on why this is important and it protects.
So that gets back another item for you to bring to us. We have to have the ability to make the marketing. It's not marketing in that sense. It's encouragement. It's the
Education.
process. It's the education, and do it in a way people understand. You know, it's one thing to throw a bunch of statistics out and a place to go get a test. That doesn't work.
No.
And it matters on whether you take the responsibility yourself. That we pride ourselves as Americans on taking our own responsibility to do it. I just need to know the reasons and help me understand how to do a better job. Those kinds of things we need to figure. And it might mean you need a couple more people to help you guys come up with the options.
Well, we have a group of 3 plus myself, and the guys have shown themselves to be very, very quick and very industrious. So I'm hoping that, plus I do have a person who has offered to.
Well, even a psychologist can help you. I mean, let's look at, just open up your eyes here a little bit. It's not just statistics, guys.
That's okay.
I'm talking
Don't worry, I
about.
have no interest in that.
Okay, gotcha. All right, any other?
So I
Go ahead,
have
Tom.
another topic I want to bring up, moving on. And that's deal with whatever platform we choose to use as a governing body of this county. To my chagrin, we've included Facebook. I understand why. That doesn't mean I like it. But I want to go on record as saying that as a Board of Health member and subsequently as a county commissioner, I will not govern this county based on Facebook. That is people's opinions. we cannot control what happens on Facebook. If we, and it just happened this week, we posted something on Facebook that was accurate. The minute we give that up to Facebook, as I understand it, we lose control of what happens to it. So if the people in this county want to be governed by the stuff that they see and read and believe on Facebook, then they're going to be very disappointed in me because it has no merit for me. I understand that the large majority of the people now rely on Facebook to get their information. I would submit to everybody in this county, that's fine. That because it's on Facebook does not mean it's fact. If you want the facts, I guess you sit in on these meetings. Or you call and ask, hey, what are the facts about this?
Or you go to the actual face of the media that public health has or the county has.
The
Official.
In my opinion, the only true, pure source of facts pertaining to the county are those that appear on our county website, because of those are the only ones that we have control of. People say, well, I saw it on Facebook. Okay, you can read it in the funnies too. It doesn't matter to me. I just think if you're talking about governing, that we need to do it on some much more realistic and reliable system than Facebook. So that's my thoughts about that.
Okay, thank you.
Here, here.
Amen.
Okay, any other comments on it? All right, right now, that's all the items that I had down to discuss. We're going to have an executive session here, as we mentioned earlier, and then we'll have time for other public comment after that. If there's any other questions, maybe it's appropriate because we've mentioned a couple of things. Is there anybody else that has an issue related to what we've just talked about? We'll give you a chance to ask a question right now, and then we're going to go into an executive session.
This is neat. I'm sorry. I just want to chime in. I agree on the Facebook stuff, but what I'm noting, I do go to the website because I agree that's more the official information, but it seems to be behind on things. So urge whoever the webmaster is to really update that and then refer people to that, because that's what I'm finding. It sometimes is.
Thank you, Nita.
Yeah.
And actually, you're preaching to the choir, because we are updating our processes and personnel. We are undermanned in a couple areas, and that was one of them. And so we're working on it. And we've got the guys that are working overtime right now to get what we're doing done, and are doing a great job. But what we got,
that question?
Nita Lynch.
Okay. Yeah, thank you. Yeah, just because I agree, that's the place to go for it.
Okay, thank you.
Thank you.
Okay, any other comments? We're done for now, and we're going to adjourn the Board of Health meeting. And I'm just saying that's the next step. I'm not doing anything yet.
I don't think we're going to adjourn.
No. I mean, this.
So, Mr. Chairman, I would move that the Board of Health move into executive session under Colorado Revised Statutes 24-6-402, sub 4, sub F, sub 1, and sub 2 for personnel matter. I would invite Dr. Brown and the Board of Health members to set in on that, as well as our IT person, so we can continue to get the recording properly, and our attorney, Clint Smith.
Okay, second. Jay, you want it? Okay.
I'll call you or text you. Okay, thank you.
You there, Jay?
Can I ask the
Can you hear?
cell phone?
He's trying. Are you trying to call in on the cell phone, Jay?
Yes, sir. I'm on the cell phone for some reason. Meeting itself cut my voice off. I called it a Zoom call.
Okay, so there's been moved and seconded that we move into an executive session for discussion of a personnel matter under Colorado Revised Statute Section 24-6-402, paren 4, paren F, paren I, and 2, and not involving any specific employees who have requested discussion on the matter in the open meeting. Any member of this body or elected official the appointment of any person to fill the office of this body or an elected official, personnel policies that do not require the discussion matters personnel to particular employees.
So we do need to vote on that.
Yeah. All in favor, Jay?
Aye.
Tom?
Aye.
Kanda, aye.
So in the interest of security, I'd like to end the meeting and have Jay call in on a cell phone on to like one of your cell phones. Otherwise, we're gonna have, I can't.
Okay, so we will have to do that. We will end the meeting. We will restart that meeting as soon as we're out of session.
You're welcome to call in online if you'd like.
I'm gonna hang up and I'm gonna call Tom's private cell phone. Is that acceptable?
Yes.
Appreciate that. Thank you.